Adult CPR and defibrillator AED video. Check for danger. Remember that you cannot help if you become injured. If the area is safe, approach the casualty and check for a response. Gently shake each shoulder and ask loudly, "Are you okay?" If there is no response, open the airway. Place one hand on the forehead and the fingertips of your other hand under the chin and gently tilt the head back. Look, listen and feel for normal breathing for no more than 10 seconds. If they are not breathing normally, shout for help and get someone to call 999 or 112 and send for a defibrillator, also known as an AED. If you are alone with the casualty and have a mobile phone with you, put it on loudspeaker to communicate with the emergency services, but do not delay starting CPR. Kneel at the side of the casualty, level with their chest. Place the heel of one hand in the centre of the chest, towards the bottom of the breastbone, and the heel of your other hand on top of the first hand, and interlock your fingers. Raise your fingers away from the ribs. Lean over the casualty with your arms straight and press down on the breastbone to a depth of 5 to 6 centimetres. Release all of the pressure from your hands, but maintain contact with the casualty's chest. Allow the chest to rise fully. This is one chest compression. Do 30 compressions at a rate of about 2 per second. You are aiming for 100 to 120 per minute. Now give 2 rescue breaths. If possible, use a protective barrier such as a face shield or face mask. Ensure the casualty's airway is open by tilting the head back. Pinch their nose firmly closed. Take a normal breath and seal your lips around their mouth. Blow into the mouth until the chest rises. Remove your mouth and allow the chest to fall. Repeat once more. Continue the CPR cycle of 30 chest compressions to 2 breaths. If an AED arrives, switch it on and follow the voice instructions. You or your helper will need to expose the casualty's bare chest by undoing or cutting their clothing. Peel the backing from one pad at a time and place firmly on the casualty's bare chest in the position shown. Place one pad below the casualty's right collarbone. Place the other pad around the casualty's left side over the lower ribs. Stop CPR while the AED analyses the heart rhythm and make sure no one touches the casualty. If a shock is indicated, make sure that everybody stands clear. Press the shock button as directed. If it is a fully automatic AED, the machine will deliver the shock automatically. Continue to follow the voice or visual instructions and restart CPR at a ratio of 30 chest compressions to 2 breaths. Do not stop doing CPR until a health professional tells you to stop. You become exhausted. If there is more than one rescuer, do about 2 minutes of CPR each, but minimise any interruption in chest compressions. The casualty is obviously responsive. They wake up, move, open their eyes and breathe normally. Taking care of yourself after giving CPR. Trying to resuscitate someone can be a very traumatic experience, and it is important to look after yourself and to be aware of the symptoms of post-traumatic stress. Please visit the website of the Royal College of Psychiatrists for further advice.